And I also appreciate and applaud your passion to reduce maternal morbidity and mortality, especially among Black women who we know die 3 to 4 times more and have birth complications 3 to 4 times more than white women. And that is even when you account for those who have privilege, who have health insurance, who have had access to prenatal care. So again, applaud you for highlighting that and your work, because that's so important. So can you hone in on that a little bit more and tell us about the work you've done to help to reduce maternal mortality and morbidity?
Absolutely. So I think the first thing is just starting the conversation and talking about it and recognizing that bias exists in all of us. And when it does exist, really understanding the impact that it can have on how we treat our patients. And so realizing the different barriers and the systemic issues that are impacting our African-American women that are leading to this alarming statistic. And so really, since it's more of a systemic issue, it's really trying to change some of those things. And so I think the biggest thing is by having more of us, people of color, specifically Black women, in those leadership positions, sitting on those task force, sitting on those different panels that are making decisions at the hospital. And also by, I think, reaching back to our youth, it's important to get more kids involved in pipeline programs to be able to get them to go into these medical fields, because at the end of the day, that's what makes a difference as well, because there's even studies that came out in the past couple of years as well that has shown that patients that are cared for by African-American physicians actually fare better. And it's because it's eliminating some of that racial bias that we know occurs. And so, which is one of the major factors when it comes to the maternal morbidity and mortality crisis that's occurring here in America. So I think that those are a few of the things that I've definitely tried to talk about and just really make everyone aware that these issues exist, because some people are blind to it. And by identifying that these issues exist, moving forward to how do we fix these issues? And it's not something that changes overnight. So really kind of coming up with different strategies and plans to really get to the root of the issue.
And you mentioned systemic issues, and I think that's critically important to amplify. Yes, individual biases certainly must be reviewed and looked at and overcome, but we also need to look at the larger systems when we are talking about these unacceptable health inequities when it comes to maternal mortality and morbidity.